Hello everyone, my name is May Tan. I was Miss Manila 1980s. I'm here now in CSA Medical Aesthetics. I was referred by my friend, one of my friends, and of course at first I was not convinced. I do research through YouTube, tapos yung mga hearsay. Then when I came here, first time, and she did something in my face, and I love the way she do it because magaan yung kamay niya, and the stuff are very nice here. The reason why I'm here is because the main concern is this one, the nasolabial fold here. So she's gonna do something, so please watch out. She's gonna do it later. Please don't forget to subscribe and click the button below and also the notification bell to keep you posted.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. There's a saying that a thing of beauty is a joy forever. In today's episode, we have a guest who has this joy forever because she's already beautiful inside and out. Sa mga ka-CSA, let us all welcome Miss May.
Yes.
Welcome! Yeah.
Welcome, Miss May.
Right? So, itong joy forever, Miss May, di ba? It's something, it's not only outward, but it's also inside us.
Yeah.
Right? And let's ask Miss May, ano ba yung mga usual activities nyo right now?
I do charity work,
Yes.
like kasi meron akong women's organization.
Oh, okay po. That's good. Yan. Dr. Nina, si Miss May, I think she had seen our videos, right po? Okay, yung mga non-surgical procedures natin na walang cuts, walang mga, alam mo na, tsaka yung mahabang downtime, yung mahabang pahinga. Kasi gusto lang ni Ma'am May is something also very natural. And of course, not so invasive too.
Yes.
And not changing her looks. Gusto lang niya yung it's gonna still be her. Yan. And busy si Ma'am sa kanyang mga activities. Sa mga, meron din pong mga iba pang pinagkakaabalahan. Aside from that, I think sa family din po. Family person
How are you
din.
giving up for physical activities you have? Nag-exercise po ba?
Swimming.
Ayan,
cardio,
nagsuswimming.
yeah, gym.
Nag-gym din?
Yeah, it's very significant talaga na we have to stay healthy. We really have to work out. So it's not only the diet thing, but of course the physical activity. You have to work out all those muscles para maganda yung circulation natin. And maganda na rin
Yung
ang
skin, glowing skin.
yan, glowing skin na rin.
Opo.
So with Ma'am May kasi, of course, she wanted to maintain. Yan, maintain na lang.
yes.
Yung sinasabi nating beauty forever. Okay,
Yes.
I looked at her face. Of course, yung assessment na naman natin. Whenever we do mapping, we look at the upper, middle, and the lower thirds of the face. Okay? So pagka upper third, we assess that. We check on some presence of lines there, or volume loss there, or sagginess, or hooding of the upper eyelid, pati yung temple, chine-check natin. And then the mid-face region, ayan, yung under eye, chine-check natin. Tapos yung mid-face, chine-check natin. Tsaka yung middle cheek, lateral cheeks, chine-check natin. And then pagdating sa lower third of the face, ayan, yung sa lip area, and then jawline, and then the chin. Ang main concern kasi ni Miss May right now, ang ang unang-una po nating concern ngayon will be the so-called nasolabial fold.
Ayan, malalim na siya, Doc, no?
Yes,
Nasolabial.
Yeah. Kasi as time passes by talaga, yung mga tissues natin sa middle part ng ating face, they sag, they go down with the pull of gravity, tapos yung loosening na ng mga tissues doon, laxity, at saka yung mga ligaments, nagwi-weaken na, all the weakening of those tissues inside. So yun, bumabagsak. It goes down. So when this one goes down, itong tinatawag na, ito, nasolabial, tapos yung dito, yung sa malar tissues here, when it goes down, it creates that deep nasolabial crease or line there. Right, Mamia? Mamay. So it creates that deep fold. So as time passes by yan, it worsens, it becomes deeper. Nagkakaroon din ng sinasabing volume loss in that region. Okay, so that's why Miss May is here for us to do correction on that. Kasi pag sobrang nga namang lalim, di ba, it's like creating or giving that yung
Parang old look or
right,
depressing look, parang gano'n.
Yes.
So we have to lift it, no? Anong,
Right.
with non-invasive, kayang-kaya
Yes,
yun.
right now we're gonna present to you ano bang non-surgical way to also correct itong deep fold na ito. And of course, to also include na yung marionette line. Yan. Concern din ni Miss May, ito, right po?
Opo.
So it's very distinct dito, or the others call it puppet line. So itong area na to. Or meron pa silang ibang term, yung labiomandibular crease.
Oh, wow.
Labiomandibular crease daw. Okay, we wanted to do also correction on that. Okay, excited ako, Miss May.
Me too. Excited,
Yan.
excited.
Ano po kaya ang non-surgical procedure that we will be doing for Miss May today? Ating abangan sa pagbabalik ng CSA Medical Aesthetics. And we're back mga ka-CSA. So, we'll now show you the procedure on the correction of the nasolabial fold. Okay, so the first step is to do cleansing of the area. So we have to really disinfect. So we made use also of the betadine to clean the area. And then actually we did apply a topical numbing cream. We left it for about 45 minutes. And then after that, we'll be ready with our procedure. So the first thing that I will be doing is to inject our hyaluronic dermal filler. So when we correct deep nasolabial folds, we do the injection of our filler, hyaluronic filler, so that it will be lifted up or you restore the volume. Then after this, I'll be combining with a volumizing PDO threads to further correct that nasolabial fold. Because once our hyaluronic filler had been absorbed and also the thread had been absorbed, it will be replaced by our natural collagen. Okay, so we have an area here that was cleansed already. So I have to make an entry point for my dermal filler because I'll be using a cannula here. So for the entry point, just lateral to the corner of the mouth, I'll make a tiny prick here. Inhale, exhale lang po, ma'am. And then I have a hyaluronic filler with a cannula. So I'll just glide this cannula into that nasolabial line here. So it's just gonna be gliding, okay, towards the collar groove. Okay, so we can push our filler here. It's a so-called linear retrograde technique. Then you can also make it into a fanning technique. Okay. So pressure lang, Ma'am May. Okay. You feel like something like slugging into your tissues. So you wanted to also reach that collar groove over there. So that's one thing also that's giving that deepened nasolabial line. Okay, so it's a fanning technique right now. So filling in with our hyaluronic dermal filler. Okay, then after that, we can combine with a volumizing thread. So we will be using our PDO volumizing threads. Okay, so as you can see, it has this bluish-like color here. And then we'll be using the same point of entry that I did for the hyaluronic dermal filler. And this is a cannula, it's blunt. Okay, so once you insert it into that opening you have, okay, so just glide it towards your groove there. Okay. So this one has varying lengths. So we have some like a 60 millimeter length, 50 millimeter length. Okay. So depending on the length of the treatment area, you have to use that kind of thread that will be fitting into the length of your nasolabial line. Okay. So ma'am, you'll just feel it like on the sides of the nose. Okay, I have to push the entire cannula towards that line. Okay. Pressure lang po. And there you go. Then pull it out. Okay. So our second PDO thread, okay, is towards the medial aspect. Okay, lang po. Pressure again of our line. So I think we're using the 60 millimeter type of PDO. So you'll feel it lang po below that groove. Let's see. And then we pull it out po. Okay. And then the last one po and we're done. So once we have corrected our nasolabial, I mentioned a while ago that we'll also correct our labio-mandibular line or the so-called marionette line. This is the last na lang po. Medyo pressure lang, Ma'am May. We have to leave the entire thread into the nasolabial line. So on this last thread that I'm pushing into, I go a little bit deeper to really give those anatomical planes some stimulation of our threads. Okay. So we have done correcting the nasolabial fold. Now I'll proceed to the labiomandibular line or the so-called marionette line. So I'm just using my light filler here or soft filler here because it's going to be a superficial injection only. This is to follow the marionette line here towards the corner of our mouth. Okay. So Mami is just okay. Filling in lang po yung line na yon just to remove that dent. So it's also the concern of Miss May, the so-called marionette line. So I'm just pushing this soft filler here. Okay, there you go. We proceed to the other side. So we are proceeding to our left side. Again, we're starting with our dermal filler. I'll make a tiny entry point. Okay. Just a pinch, and then I'm gonna insert my filler here using the cannula technique. So sponge, please. So this is a gauge 25. So when you use a needle to puncture, you can use a gauge 23. Okay. Ideally, there you go. And then towards our collar groove there, so you make a linear retrograde technique there, like a threading technique towards our nasolabial groove there. So you can push your filler slowly. So whenever you inject a dermal filler, it's better to push it slowly. Then you can do a fanning technique from this entry point. Okay. So the good thing with our hyaluronic filler, it also has lidocaine, so it already adds to the comfort. So before we were doing like a nerve block or the infraorbital nerve block. So because our filler already has lidocaine with it, so we don't need to do the nerve block anymore. So when we insert our twist threads or the so-called PDO volumizing threads, so there's already some numbing there. There you go. So I'm just filling in this deep collar groove here. Okay, then after that, we make use of our PDO threads. Those are volumizing threads. They're actually like a scaffold of threads in that cannula. So we have an entry point, so take note the cannula is gauge 19, so we can make use of a needle gauge 18 to puncture your entry point. Sponge, please. And so I have a gauge 19 here, and I have a thick PDO thread here. So you just have to insert that, and then towards our aller groove. Sometimes there is resistance. So in this plane, you wanted to stay in a subdermal plane. There you go. So actually there are two planes that you can insert your volumizing threads. You can use the subdermal plane, and then also you can use the deepest plane. So we have a long video thread here. It's a 60 millimeter. So some resistance there. Okay. We wanted to correct this deep fold here. There you go. You just have to make sure that the entire length of the thread is inserted. And another one. So actually we did an assessment before. We've noticed that the right side is deeper than the left side. So even Ma'am Mia, when I asked her, she said that the right side has a deeper nasolabial fold. So I'm doing our left side here. So since the left side is less deeper, or it's shallower than the other side, I can use less threads here. Okay. Some pressure there, ma'am. Sorry po. Then I think I'll just use minimal volumizing threads on this side here. Some tugging effect lang po. So we have done threads on the nasolabial fold. So I'm adding our soft filler for the marionette line here, or the labiomandibular line, and again injecting in a superficial plane, since this is just a soft light filler, so towards the corner of the mouth. So we want to fill that in. So we're eradicating those so-called puppet lines, and these are hydrophilic fillers, so Ma'am May will just have to drink a lot of water po, since she has a healthy lifestyle, so adequate naman ang kanyang water intake. So we have done the correction of nasolabial fold as well as the marionette line. We'll show the result when CSA returns. And we're back mga ka-CSA, so we are at the part of showing the result to Miss May. So ayan na po ang ating salamin.
Here's the magic mirror.
Okay. So yan.
So ma'am, drink lots of water because that's a hyaluronic acid.
I drink ka.
Yan.
Yan. Okay.
Tapos it will, it will improve pa, sabi nga ni Doktora po, every week. Ganon. So you have to follow up here for 2 weeks. After 2 weeks po. Are you happy, ma'am? Yeah.
Although may konting lang, yung syempre, whenever we insert something, may discomfort. You feel something is coming in. Now, bagong pasok pa lang yung mga products, they were newly inserted. So, we have to give time for these products to still take effect, to still work. Okay? Kasi whenever we do mga injections or insertions, of course, these products will work inside. So, we have to give them time to still take effect and do their job inside our
do their
tissues.
job.
Exactly. Okay? And sa follow-up ni Ma'am May, we'll still show you yung further improvement, like 2 weeks, you can still follow her up, 4 weeks, and even a month or 2 months or 3 months later. Okay? Since we're doing non-surgical procedures, these are products that still will work inside our tissues. Physiologically speaking, they will still have an effect as time passes by. Okay? So, any other question, Ma'am May?
No comment.
Yes.
So what we did was lift yung sunken fold. So we filled it in, nagkalaman. So still give time for it to still work. Kasi if you overfill a certain anatomical defect, kapag ka naman nag-overcorrect ka, yung overcorrection na yon, baka weeks pass by, baka naman maging bulge naman na siya. That's the thing eh. So, we'll let these materials work inside first and then we'll see further improvements pa po. Ayan. Any additional input, Dr. Ninya?
Well, if this is very safe and proven, no, if you have the same problem, just go here in CSA. You're in good hands. Yan, Doc.
Yes.
Ang ganda, Doc.
Safety is very important, as well as the products that we use should be scientifically studied. Okay, they were like tested clinically, and we have already done procedures like this before, and we have good reports, good feedback already.
Yes.
So, sa inyo po na may katanungan, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, and Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong Maragol, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. Ang iba naming mga topics, you'll find them in our YouTube channel. Just type Contessa Salvador. So, thank you very much. Thank you, Ma'am May.
Thank you po.
Thank
Salamat
you,
po.
Dr. Ninya. And salamat din po sa inyong lahat. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.